Hello everyone. Welcome to Dr. Shankaran's online homeopathic clinic. I shall wait for some of our followers and well-wishers to join us today on a beautiful Sunday afternoon and on this beautiful day, which is the last day of the 10-day Ganesha festival here in Mumbai. And it's a beautiful day, and I thank you all for joining today. Lovely. It's so nice to see the enthusiasm build up slowly. That's wonderful. Thank you so much. We have our second Q&A session, our second interview and talk with Dr. Shiti Mehta today. So it's going to be very, very interesting because we are going to talk about respiratory illnesses, especially in the wake of COVID-19, and how everything has changed a lot in terms of the focus being more on immunity and building up your inner resilience towards all that we have to face today. So Dr. Shankaran's online homeopathic portal is a very, very important and key portal today to gain online homeopathic consultation by the best doctors from the comfort of your homes. So especially during the pandemic, when you want the best treatment from the comfort of your home, you can just log on to the portal and book your appointment with 4 wonderful doctors who have been trained and handpicked by Dr. Rajan Shankaran himself. And they all are very specialized, and they have adopted his vision and his work ethos. So it is beautiful that these doctors have taken his work forward, and they are doing a fantastic job with their patients. And this is a unique way to connect with them wherever you are in the world. So please do join Dr. Shankaran's online homeopathic portal, and where there's more information about all these concerns. One very important feature of the portal I would like to convey today is the 15-minute advisory call. What you all can do actually is that you can book a 15-minute advisory phone call with any of the qualified and highly trained homeopathic doctors who are on the portal, and you can discuss any issues and concerns that you have regarding your illnesses and different areas and concerns of pain. So they will assist you basically to prepare for your initial consultation. You can talk to them about the current treatment that you're going through and how homeopathy will help you to take you to the other side where you can benefit from it greatly. So please do avail of this wonderful opportunity to book a 15-minute advisory call through the portal. And you can talk about your medical issues, your general health concerns, and it will be really enlightening before you even book your first appointment. So please, I would urge all of you to go ahead and do that. Thank you. And today we have, of course, Dr. Shiti Mehta. What can I say about Dr. Shiti Mehta? She is a wonderful, wonderful homeopath who has had over 15 years of experience treating patients across all over India and even overseas. And she is currently heading the overseas patient department, and she's acquired extensive experience under the mentorship of Dr. Rajan Shankaran, and not only him but even under different homeopaths. Her expertise is in the field of pediatrics, mental health, and psychiatry. And she's also been a professor at a homeopathic college in Ahmedabad, where she herself studied. So it is wonderful to have Dr. Shiti Mehta here today, and she is very passionate about educating patients across the public and basically creating awareness about the effectiveness of homeopathy. She's very passionate about that. And her basically, if you want to go from a stage of disease to ease, I think that gap can be bridged by Dr. Shiti Mehta, because she will hold your hand through everything and take you across from a state of dis-ease to a state of ease. So please help me welcome Dr. Siddhi Mehta right here, who will be joining us in a moment. Hello.
Hi.
Hello,
Hi,
Dr. Siddhi.
Smita.
Hello, Dr. Siddhi. Welcome to our Instagram live, and it's a pleasure to have you here today. Yeah. Thank you very much for joining us.
So thank you for the invitation, and it's really a pleasure for me also to be here on this online platform and be of help to others.
Yes.
So friends, today, in this last 2 years with the COVID situation,
Yes.
COVID has actually changed our perspective towards everything.
Right.
We have become much more careful and cautious about our health. We don't
Yes.
want to fall sick. And a little sneeze or a little cough or some mild fever or a little bit of a pain in the throat, that we would be alarmed. We would check our temperature often. Is it COVID?
Yeah.
Isn't it? So,
Yes.
and we all know that we are taking measures to build our immune system. Because
Right.
obviously we all are breathing the same air. But
Yes.
why some people are getting affected with the COVID
Mhm.
or with any other respiratory illnesses, and why not others?
Right.
So it's all about immunity. It's all about building a strong immunity. And
Mhm.
I can tell you that homeopathy definitely has a good scope in building up the immunity, treating conditions like common cold cough to tonsil infections or nasal polyps to sinus infection or even asthma or pneumonia, bronchitis, or even lung fibrosis.
Okay.
So,
Okay.
yeah.
Okay. Wow, thank you, Dr. Shruti. It's very interesting to know that because yes, the past 2 years has changed a lot, and any breathing difficulty, and there's a sort of panic or an alarm,
Yeah.
and we are happy to know that homeopathy can really help us, and it can help us to really eliminate these sort of issues from the root rather than just treat it symptomatically, right? That's
Definitely, yeah.
okay, okay. So thank you, Dr. Shruti, for sharing that with us. And for all our viewers today, if you all have any questions for Dr. Shruti, please do type in the chat box, and Dr. Shruti will try her best to answer all your queries regarding respiratory issues or any other general health concerns also that you may have. And so, Dr. Shruti, children have, like you just now mentioned, like in conditions like allergic cough and cold, especially with children, tonsillitis, asthma, all these issues. So, can you tell me how can homeopathy help this age group specifically?
Sure. So, if we often see that such conditions like allergic cough, cold, or tonsillitis or adenoids, all these conditions are kind of recurrent in nature.
Mm-hmm.
They keep
Mm-hmm.
coming after one episode after the other. So, so today, if your child gets, say, cold or cough or tonsil infection or high-grade fever or flu or anything, then you go to an allopath where he would prescribe a kind of antihistaminic, anti-allergic medication or some antibiotics or maybe some steroids or some
Yeah.
inhalers in case of asthma, right?
Yes.
So,
Yes.
well, that will be addressed and the child would be playful and happy and fine for some time. But
Mm-hmm.
again, after say a month or two, again the child would suffer with the same illnesses. So
Yes.
what are we
Yes.
doing here? We are kind of treating, the approach would be kind of treating the patient symptomatically and treating the just the part. Right now the problem is there, let us solve the problem. But we
Mm-hmm.
don't question that why the child is suffering with this tonsillitis or cold cough so recurrently, so often.
Mm-hmm.
And
Right.
that is where the role of homeopathy would come, where
Mm-hmm.
we would address the condition right from the root, and try and understand the physical complaints what the child has, and also the other areas like his nature, his mood and mind state, his dreams, his fears. All this we take into consideration and prescribe a remedy which treats the asthma or flu of that particular child. In the sense that we are giving a kind of a unique or a customized remedy for that given patient,
Okay.
where we are not just treating the asthma, but we are treating the person behind this asthma.
Right. 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 That's very interesting. So even with children, the sort of treatment is very individualized. You're saying if you have two children with asthma as a common complaint, but the treatment and the remedy could all be different. Could be different.
Absolutely.
Okay.
Like for an example, like one child is suffering with asthma and getting up at right in the middle of the night, say exactly at 1 a.m. and very restless. He cannot lie down. Lying down worsens his breathing difficulty, and he gets up, sits upright, sits erect, bending little forward. This is one symptomatology for us. And similarly, another child with the same diagnosis of asthma would like to lie down right on the abdomen with the open mouth, protruding the tongue out. So this becomes an important symptom for us, a kind of a key for us to prescribe a particular remedy.
Right. So somebody has asked here, Dr. Shruti, my husband has a sinusitis infection from childhood, and a change of season troubles him a lot. So any solution for this, Dr. Shruti? Thank you, Rishika, for your message, for your question. Thank you. Yes.
Yeah, Rishika, so basically we need to address why your husband or a particular person is getting this sinusitis, because he's prone to it. Some people are prone to certain diseases. So like in his case, this is his proneness. This is his tendency to get it. So if we build his immunity, if we find out what are the factors that are causing it, also about his nature, his mood and mind state, his personality, we understand everything together and then give a remedy in homeopathy. And you can see in the long-term effect of it would be that the frequency and the intensity of his complaints would go down, and thereby a day would come that he would not be suffering with sinusitis in spite of the change of the season.
Oh, that is wonderful. That is wonderful. Yes, that would really be good. But Dr. Shruti, in terms of the time to treat such a thing, how long do you think something like this would take, this sort of treatment?
Sure. So it varies from case to case. The course of treatment definitely varies from patient to patient. We need to see that, say for example, Rishika's husband was suffering with this has been suffering with sinusitis since childhood, right?
Yeah.
So we need to see that how long the disease is, and what other areas, what other factors are there that are causing the difficulty to treat the particular condition. And I would say that minimum for 6 months, minimum. If you want to take homeopathic treatment, minimum for 6 months, one needs to be there with a particular homeopath and take a proper treatment, do a regular follow-ups, and then see that how the improvement is happening.
Okay. We have another question for you, Dr. Shruti. We have somebody who's saying that her brother is suffering from pneumonia, and he's got affected by pneumonia, and his whole immune system has got affected very badly. And what should we do now? And he's very, very weak. So what should we do in this case? Yeah.
So as far as the diagnosis is concerned, for example, pneumonia or sinusitis or asthma, right? What is important is that we understand each and every case in a way that we understand more about the pneumonia as to what are the symptoms, like how often does he get cough, what position that increases his cough, what type of discharge that he is getting, what is his thirst level, what increases his troubles, what reduces his trouble, what position that makes him comfortable. So this is about the one aspect of the pneumonia. of
Mm-hmm.
his pneumonia. And
Right.
also, then we need to understand his nature, his mood, mind state. What are the things that he's sensitive to that affects him emotionally? What dreams is he getting? You know,
Right.
and
Right.
what stresses him? What is behind? What is a common thing running behind his all the such areas of life? And then we prescribe a remedy that will help his pneumonia, his weakness, as well as his overall immunity. And
Right.
that way we can help him.
Right. Right. Oh, that's wonderful, Dr. Shruti. Uh, Thank you for clarifying that. And we have a lot of questions for you, Dr. Shruti, from our audience. And somebody has basically said that is pneumonia something that is hereditary? Is it something that's passed on? Even grandkids can have asthma. Is it something that is? Do you see this component
So,
of?
I would say that certain diseases are hereditary, meaning you have a genetic predisposition
Right.
towards it. Your proneness of a particular disease would be there. Not necessary that a grandfather or father had pneumonia, meaning next generation also will have pneumonia. No, it is not necessary. But
Yes.
definitely you have the proneness to a
Hmm.
particular condition. That particular condition, it's like a weakness in your system, in your soil, right?
Right.
And
Right.
if right right type of healthy lifestyle is followed, and his a person's immunity is corrected, then this proneness also can be addressed, and not necessary that he would fall sick with pneumonia.
Yes, because somebody has mentioned that his wife has asthma, so they're worried about their daughter also,
Yeah.
getting it. So obviously, parents have so many concerns, and it is something that is it's very worrisome, especially when your child has, especially respiratory issues, and it can really, really, and recurrence. You said the recurrence of the respiratory issues can reduce with homeopathy. You're saying the recurrence of those things?
Definitely,
Okay.
it can reduce, and over the period of time, you will see that the frequency of the attacks
Mm-hmm.
and the intensity of the complaints also would reduce with the long-term treatment of homeopathy.
Right, right. That's very encouraging, Dr. Shruti. Thank you so much for clarifying that. I'm sure it's helping a lot of parents who are online here today. And so even the inhalers we talked about, the bronchodilators and, all these nebulizers, steroids. So once we start a parallel, treatment with homeopathy,
Yeah.
can you reduce the use of these other medications? Is that?
Yes, definitely. This can be reduced because, see, every pathy has its own advantage and its own beneficial effects.
Of
In the
course,
sense
yes.
that if one has acute, very very severe spasm of the windpipe, and his
Mm-hmm.
child or a person is not able to breathe,
Mm-hmm.
and it requires immediate intervention. At that
Right.
point in time, definitely our use of inhaler might temporarily help his spasm to get relieved, and
Yes.
that would kind of relax. But it is a
Hmm.
time being short-term solution. But
Okay.
the recurrence of it, that why he's keep on having this, if that needs to be, we need to address it, then homeopathy would be a better solution.
Yes, yes, definitely, Dr. Shruti, definitely. We would like our children to take less medications that affect them, over and over and over again, the same sort of medications. Right, right.
And
That.
also the drug dependency, that
Hmm.
you from childhood one has asthma, and for years
Yeah,
together, 30, 40,
yeah,
50 years, one keeps on taking inhaler, like kind of
yes,
your system is getting dependent on that inhaler or on that steroids. So this
yes.
also can be addressed very well with homeopathy, where your wherever it is needed, yes, we need to intervene, we can. But if it is
Mm-hmm.
not needed, when the immunity improves, then in spite of the acute attack of asthma, that can be handled with the homeopathic remedies. They work like magic.
Wow, that is
Yeah.
wonderful. Yeah, so instead of definitely during an acute attack, if homeopathy also helps, it is fantastic during these conditions. Yeah, thank you, Dr. Shruti. Yes, is there any any lifestyle changes, Dr. Shruti? Do you think we should make so we prevent getting respiratory infections over and over again. I mean, I know we live in a place where we have high pollution levels, and I think things are just becoming, worse day by day. So how can you give us some tips on improving our
Yes,
respiratory?
definitely. So, it's not just the respiratory thing that is important. It's
Right,
like what
right.
I would say, and I always tell my patients that this is the only body, only house you are living in.
Yes.
The building, the makan, the whatever you are living in, that is one thing, but your soul is getting expressed through this physical body, right?
Yeah.
And
Yeah.
it's like, for example, if you have a petrol driven car, would you
Hmm.
ever put diesel in that?
No.
And
No.
do we ever think, when putting junk food and things which are unhealthy, we keep on
Oh,
munching it and keep on having it? Have we ever are we ever thinking about this before putting that? We put diesel in the petrol driven car, isn't it?
yes, we
In this
do.
scenario. Yeah.
In this
So,
scenario, we do.
right kind of a healthy diet is very, very
Hmm.
essential, not only for
Okay.
respiratory illnesses, but in general to keep
Right.
your life, your body to be fit and fine.
Mm-hmm.
Besides the diet,
Mm-hmm.
regular exercise,
Mm-hmm.
walks, yoga, and is equally important, and also the pranayam, the breathing exercises. What is
Yes.
important to increase the lung capacity? That also is equally important. So if we live healthy lifestyle, then our immunity will remain intact. And if that is remaining intact, then we will fall sick less often.
Hmm. 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 So, Dr. Shruti, I also read that you recommend a plant-based diet, a vegan plant-based diet. Is that what you recommend?
Yes, so we have seen often in many autoimmune cases and chronic
Mm-hmm.
long-standing diseases that
Right.
when we put patients on a plant-based vegan, meaning no milk and no milk products kind of a diet,
Yes.
uh,
Yes.
preferably organic diet without any pesticides and all, then
Okay.
we see that the response of the patient towards the treatment also
Hmm.
improves, and overall, in general, the health improves of the patient.
Okay. Okay.
Yeah.
Okay. Oh, thank you, Dr. Shruti, for enlightening us on these very, very important issues. Thank you so much. And now, Dr. Shruti, whom do we have on board?
Of
Uh,
course, Dr. Shankaran. So,
yes.
with the COVID scenario, he has great experience treating variety of cases. And why don't we invite him and take some, uh, guidance from
Yes.
him? Yeah.
Yes, yes. Thank you, Dr. Shruti. Yes, Dr. Rajan Shankaran is here with us now, and Dr. Rajan Shankaran and Dr. Shruti will enlighten us about COVID-19 and how homeopathy has really been helpful in this very, very difficult time. Thank you, Dr. Rajan.
Well, since the beginning of this pandemic, we have handled several hundred cases of COVID, if not in thousands.
Mm-hmm.
And we have handled them of all kinds of stages and also post-COVID complications also. And I must say that we have found homeopathy to be extremely effective in COVID cases. Now, we have to understand this a little bit more. So when we say a COVID case, you have cases that are asymptomatic. Then you have
Mm-hmm.
cases which are mildly symptomatic. Then you have cases which are moderate symptom and cases that land up in the ventilator. You see?
Right.
So there are different, and of course you have cases who don't get COVID. In the same family, everybody has COVID and this person didn't get COVID. So why this kind of difference? There's no COVID, asymptomatic, mild, moderate, and severe forms of COVID. And
Right.
the reason is basically it is the individual immunity that makes a lot of difference. And homeopathy is designed to increase the immunity.
Right.
So, in this thing, what we found in COVID is that again, each individual manifests his own symptomatology. And you
Right.
need the guidance of a homeopath. There is no standard medication. And also, when we take the symptoms, you see, one fellow is very, very thirsty. He doesn't want to move at all. He doesn't want the slightest noise or slightest disturbance. So this would be an indication for the remedy bryonia. Another
Okay.
person is very, very restless, very anxious. He's afraid he's going to die tomorrow. He wants all kinds of tests to be done right now, going to the hospital, this and that, and he checks his oxygen every 2 seconds. This person may need arsenicum album. So like that, we have so many remedies with specific indications. And when these remedies are given, it shortens the duration, lessens the intensity, and helps to prevent the complications of COVID. This is what we have found in our practice, and it's really, really, I would recommend that every COVID case should definitely look to homeopathy for, getting better.
Right, right, doctor. So, Dr. Shankaran, would you say that with homeopathy, even like some patients who would have needed hospitalization, but with intervention at the right time, even as that has been avoided, we could avoid hospitalization in certain patients? Has it helped in that area?
Yes, definitely, because we are able to bring down the duration, we are able to bring down the intensity and reduce complications. Therefore, in some cases, we are able to prevent, hospitalization also. And
Right,
also, I have experience of treating COVID cases in the hospitals of various
okay,
degrees of COVID, and very often even in conjunction with the standard line of treatment. And we
right,
definitely have noticed that when
yes.
homeopathy is introduced into the treatment of COVID, the number
Hmm.
of complications, etc., are significantly lesser.
Yes, yes. And taking this point forward, Dr. Rajan, would you say that even post-COVID, the weakness that has set in, and post-COVID sort of recovery, which is taking very long for many of us, does how can homeopathy help here as well?
Yes, here also homeopathy can help. And I must say something more here, that
Yes,
normally when you see some people have post-COVID complications and some don't, the nature
right.
of these complications also differ from person to person, correct?
Yes,
So some
yes,
people are left with a cough, some people are left with a weakness, some people are left with a loss of taste and loss of smell, etc., etc.
yes, yes,
So the nature of these complications are also differ. And I must say at this point that when
yes.
you come to post-COVID complications, the best line of treatment in homeopathy would be what we call as constitutional treatment. That means
Mhm.
here we just don't look at the acute or presenting symptoms like we do in COVID cases, but we look
Right.
at the deeper aspects of the person, like how does he think, walk, talk, feel, drink, how does he eat, drink, what does he like, what does he dislike, how does he, every aspect of him, because then we want to target the person's innate immune system and give it a kind of a stimulus with the
Right.
matching homeopathic remedy. And here a more detailed case taking is called for. And with
Yes.
the
Yes.
constitutional remedy, definitely we are able to help post COVID complications very, very effectively.
Yes, yes. Thank you so much, Dr. Shankaran, for clarifying this. And Dr. Shiti, we have a question for you actually. That there's someone who wants to know that how do you handle an asthma attack and the panic that accompanies it? They want to know from you, Dr. Shiti.
Sure. So, as I mentioned earlier, that if it is a acute asthma just at the beginning of the treatment, that
Yes,
we need to, rather than operate from fear or panic, we need to
hmm.
see what are the symptoms. For example, as I told you, that is asthma getting worse at what time, what
Right,
position is getting the child or the patient better,
right,
and
right.
is he asking for the water, or he doesn't want water, he wants to be left alone in the room, or he wants somebody next holding the hand of a mother or a parents or uh, anyone. So
Right.
all these symptoms we need to note, and if parents or patients describe the symptoms very well. You know, what even what happened, like what could have triggered it. It may not be the pollen, it may not be the change of season, but maybe a child was being scolded in the school and then suddenly he came home and he developed
Yes.
asthma. So you need to understand not only the asthma, the cause, the modality, but also the background, in the sense that what happened, what dreams he got, everything into consideration. If we take, then we
Right.
can operate. So rather than operating from fear that, oh, he has asthma, do something, he has high grade fever, what to do? My child is suffering, give me remedy right now. It doesn't help. It doesn't help a
Right.
homeopath, because
Right.
we need to find, rather than getting overwhelmed with the panic, if we focus on what the issues are and how this particular asthma is getting manifested in the through this child or a patient, then it becomes easy for us to find out the remedy. And if we give that right remedy, then in hours together, in few hours, in a day or two,
Mhm.
that acute
Right.
asthma also can get relieved.
Right.
And
Right.
important is the regular follow-up. Like in such
Yes.
acute episodes, we would be actually calling up our patients every 3 hourly, every 6 hourly to know what are the parameters, what is happening here,
Yes.
and then
Yes.
advise, okay, you continue the remedy or change the remedy and things like that.
Right.
So
Right.
this way
Right.
we can
Thank you.
handle acute episodes. Yeah.
Yes, thank you, Dr. Shruti, for clarifying that. And Dr. Shankaran, everybody here is, we are having a lot of comments saying that they are very grateful to you for starting this lovely portal where you have these 4 wonderful doctors who are they have been handpicked by you, and they are going to take this forward and really heal the world, I would say, in some way. Yeah, and thank you so much for having this wonderful initiative, Dr. Shankaran.
Well, basically, the effectiveness of homeopathy depends on the skill of the homeopath. Let's put it very plainly.
Right.
And therefore, when people come to me and say, I want to be treated by you, and
Hmm.
my schedule is so completely full, I need to refer them to somebody who I can
Yes.
trust and who I have trained and whose skill I trust in. And
Right.
therefore, I created this portal where all these doctors who are highly trained, highly skilled, highly experienced, and whom I completely trust will give the
Yes.
best quality of homeopathy possible, and in whose hands I can entrust people. So that is why this
Wonderful.
portal has been created.
Yes, yes. Thank you so much. And to all our viewers here, please note that you all can log on to www.drshankaranhomeopathy.com. And I would really urge all of you to book your 15-minute advisory call, which is absolutely free, so that, the doctors on the portal can answer your queries even before you actually book your appointment. Everything is very clear and transparent on the portal. So I really urge you to do that. Alternately, please email us care, that is CARE, @ drshankaranhomeopathy.com with your queries, and the doctors on the portal will definitely, they will reply to you. You can book your appointment and start your healing journey right from today. So, thank you, Dr. Shruti. Thank you so much for clarifying so many issues. And I think a lot of parents who are here, who have joined us, I think they'll be really happy to know that, all these issues can be treated, and especially in pediatric cases, which you're handling a lot, even cases with mental illnesses and every psychiatric issues. And we see your specialization in all these areas as well. So please contact Dr. Shruti through the portal and avail of the best homeopathy treatment from the comfort of your homes right now. Thank
So
you,
I
Dr.
want to
Rajan
I want
Chakraborty.
to just add that
Yes,
Dr. Shiti handles so many of my cases, hundreds, if more than several hundred cases all over the
yes,
world. And
yes,
people are very, very confident and happy with her treatment because she is very conscientious, very dedicated, and very experienced in
yes.
following up even acute cases, chronic cases, and her dedication and her sincerity are really commendable.
Wonderful, wonderful, Dr. Shankaran. So nice to know that. Dr. Shankar is passing on the baton to a lot of very passionate and very enthusiastic and very skilled homeopaths who are going to take this forward and who are going to really help a lot of people and are already doing so. And yes, I also do know Dr. Shruti is handling a lot of international patients. So if you have friends and family abroad, in the US or in wherever in the world, please do ask them to join the portal and to take their appointment with Dr. Shruti. Thank you so much. Thank you so much, Dr. Shruti, for all your...
I'll be happy to help any one of them, on any one of you.
Yes. Thank you, Dr. Shruti. Thank you, Dr. Shankaran. Yes, on this note, we shall now bid goodbye, and we wish you all a pleasant day, and please continue your healing journey with meditation and yoga, and see you on the other end then. Until next time. Bye-bye.